Angioedema in emergency medicine. A clinical presentation and diagnostic challenge in acute care setting. A 54-year-old woman presents to the emergency department with a 3-hour history of lip and tongue swelling associated with an urticarial rash. Which of the following is the cause of angioedema the most common? Consider the differential diagnosis carefully before proceeding to the answer. Idiopathic angioedema, acquired angioedema, drug-induced angioedema, hereditary angioedema, acute allergic angioedema. Answer is E. Acute allergic angioedema. Acute allergic angioedema is responsible for 90% of attacks of angioedema. Urticaria is a superficial swelling of the skin, epidermis, and mucous membranes that results in a red, initially with a pale center, raised, and intensely itchy rash. Angioedema is a deeper form of urticaria with transient swellings of deeper dermal, subcutaneous, and submucosal tissues, often affecting the face, lips, tongue, and eyelids, genitalia, hands, or feet. Angioedema most commonly occurs with urticaria, but may occur in isolation. Clinical features. Angioedema is a deeper form of urticaria with swelling of deeper dermal, subcutaneous, and submucosal tissues, often affecting the face, lips, tongue, and eyelids, genitalia, hands, or feet. Less commonly, submucosal swelling affects the bowel and airway. Bowel wall oedema may cause gastrointestinal symptoms, abdominal pain, nausea, vomiting, abdominal distension, diarrhea, and/or constipation. Laryngeal involvement can produce stridor and lead to complete airway obstruction. IgE-mediated mast cell degranulation and histamine release, as in urticaria, almost always occurs with urticaria within 1 to 2 hours of exposure to the allergen, self-limiting in most cases, and will resolve in 1 to 3 days, but relapses are common and unpredictable. Airway assessment. Identify etiology. Pharmacological intervention. Monitor and reassess. Remember, acute allergic angioedema typically responds to antihistamines, corticosteroids, and adrenaline, whilst non-allergic forms require specific therapies such as C1 esterase inhibitor or replacement or icabient.